and we're going to get through this together. A lot of today is going to be good news, and we can't let that cloud that we are still facing a highly aggressive to economic development, and one, an honor to our National Guard. So today, I want to start by congratulating two companies on a very important joint venture in Murray that's expected to create 37 well-paying jobs for Kentuckians. Evis Engine Systems has been a great partner in Callaway County since 2015, and I'm happy to share news today of the company's joint venture with Dido Corporation of America to expand that Murray operation. The $2.7 million investment will allow Evis Dido LLC to boost production of high-quality automotive engine chains for major vehicle manufacturers. As part of the project, Dido will relocate a portion of its operations from its headquarters in Tennessee, which in turn will allow the joint venture to expand sales channels, add to both companies' existing consumer bases, and create cost advantages by leveraging each company's strengths. Leaders anticipate the new and improved joint operation will be completed by the end of 2022. The facility is among more than 520 automotive-related operations spread across our great Commonwealth. In total, the Kentucky auto industry employs over 100,000 people and ranks number one in the country in terms of production of cars, light trucks, and SUVs per capita. These are two great companies helping to create a better Kentucky and adding to our state's impressive international presence. Evis is counted among the 78 German-owned manufacturing, service, and technology operations in the Commonwealth, which employ about 14,000 Kentucky. Meanwhile, Dido adds to the nearly 200 Japanese-owned facilities in Kentucky, which create job opportunities for somewhere about 47,000 Kentuckians. We're fortunate to have both companies in our state creating quality jobs, and this joint venture promises to drive success into the future. It's just an example, whether it's here in Murray or across the Commonwealth, about how we are not going to stumble out of COVID. We are going to sprint into our future. So next, I'd like to recognize a company in Glasgow that's been a crucial part of that community for nearly 4 decades, and it continues to grow. Spantech LLC is a designer and manufacturer of plastic chain conveyor systems for a variety of manufacturers, and the company is planning a relocation and expansion in Barron County that will take this business to the next level. Its leaders plan to construct a 100,000 square foot production warehouse and assembly operation on Hilltopper Way in support of Spantech's growing customer base, as well as the introduction of a new guide rail production line. The company currently employs more than 90 people in the Glasgow area, and this $13.2 million expansion will push their employment well over the century mark, with 40 new positions in the years to come. The operation opened in 1981 with a team of just 11 people. And today it serves major industries that include food and beverage, manufacturing, packaging, distribution, pharmaceuticals, and e-commerce. Manufacturing is absolutely an essential part of our economy, with a diverse group of manufacturers employing over 250,000 Kentuckians and impacting families in every corner of the state. So thank you to the leaders of Spantech for your continued commitment to Glasgow and Kentucky, and congratulations on this great announcement. We know that our workforce, the Kentucky workforce, the greatest workforce in this country, are ready, willing, and able to take your business to the next level. All right, this next one is pretty special. It's our Kentucky Air National Guard. So the Kentucky Air National Guard's 123rd Airlift Wing in Louisville just earned its 19th Air Force Outstanding Unit Award. The award is bestowed for excellence in mission performance, deployments, readiness, inspection results, and community involvement. Only the top 10% of units earn this award. But this is our unit's 7th consecutive award. And only a handful of units have earned 19 or more, this being the 19th. The 123rd airlift wing remains the most decorated airlift wing in the entire United States Air Force. The award was given for outstanding achievement from 2017 to 2019. And the wing's airmen are currently providing administrative support to long-term health facilities and drive-through testing sites in Kentucky as part of the Commonwealth's response to the COVID-19 crisis. Now, they have served overseas. They've been on multiple deployments. They have earned honor after honor in the Air Force, and they're currently helping us in this crisis. So, to the 123rd Airlift Wing and to all of our National Guard, congratulations and thank you for your work. Moving to COVID. Let's start with our second day of great news. And that's because this is our second day of initial vaccine deliveries. This Pfizer vaccine and Moderna are absolute game changers with 94 or 95% effectiveness, and it appears minimal side effects. It gives us a view and a vision and a certainty of victory against this virus. We just got to stay vigilant between now and when everybody can get it. So today, vaccine deliveries were made to Baptist Health Corbin, Norton Hospital, Louisville, Pikeville Medical Center in Pikeville, and St. Elizabeth Edgewood Hospital in Edgewood. Now, I think what we're looking at, or what we're going to start with, is the UK Chandler Hospital in Lexington. Photos of Robert Rose, Associate Director of Pharmacy Supply Chain at UK Healthcare, and Jonathan Laboon, Director of Pharmacy Services, unboxing the vaccine as the University of Kentucky Chandler Hospital. They received their first shipment of the vaccine today at about 10 a.m. And here they are, I know, with one of their very most favorite deliveries that they have had in the last 9 months. The first vaccinations began with frontline healthcare workers at 2:30 p.m. in that hospital. And here's a photo from some of the first vaccines being administered. These photos are incredible, right? They give us hope. They assure us of victory. And they show that these frontline heroes, I can see the picture down here. These frontline heroes know that we got their back, that they have fought for us every single day. We value their safety, and we need their help getting through these next couple months. We also have videos and photos from Baptist Health Hospital in Louisville. I know there's no sound, but it's still incredible to watch. So this is the box that it's shipped in. And this is when they remove it from the box. Remember, the box also has to have cold storage. This is them putting it in to their refrigeration unit. Remember, we've seen these shipments all across Kentucky. We will, at the end of tomorrow, all 11 initial facilities will have received that first shipment of Pfizer. Vaccinations already underway all across Kentucky in those facilities. CVS and Walgreens will begin the long-term care vaccination program that we have activated. We believe will be one of the first in the country. We hope that that starts as early as Monday. Both companies have been great to work with. And finally, Baptist Health Hospital, Madisonville, shared some photos of the vaccine arriving today as well. Let's look at those. Again, all the boxes look the same, but they're great to see each and every time. Again, you can see that is their deep refrigeration unit. And you can see what the tray actually looks like, which is pretty small within the overall box that is shipped, but it's going to protect 975 people. These shipments are just the start, but this is historic. And we're proud that it's being spread all around the Commonwealth. And we know we're starting with the populations, both that we need for healthcare capacity and are impacted the most. We will on Thursday, which is the next one of these briefings we'll do, share photos and videos from the third facility. Now, later this week, Moderna will be up for emergency authorization. We had a good report from the FDA. I think it was yesterday. If everything goes the way we think it is, we will have shipments maybe even as early as Monday of next week. And remember, that will get every other acute care hospital either vaccine directly or to a partner that is ready to store and vaccinate workers in each acute care hospital across Kentucky. Yesterday is the best day I've had in 9 months. Best day since March the 6th, and today feels just as good. Doesn't mean we don't have hard times coming. Doesn't mean we don't have to have a lot of fight left, and we got to be ready for the fight with this virus. But it was incredible news. The modern day medical miracle for which I'm grateful. Grateful to God, grateful to those that worked on creating it, grateful to those that are helping to logistically plan how to get it to everybody who needs it. Just very grateful. All right, next, our Team Kentucky Healthy at Home Eviction Relief Fund. Since yesterday's application reopenings, the Healthy at Home Eviction Relief Fund has had at least 50 additional completed applications. We estimate those average about $3,000 per tenant, equaling $150,000. We are continuing to keep the portal open because we still have about $1.4 million remaining to help people on their back owed rent. And the application will remain open until all funds are exhausted. The reopenings is for past due rent from March through December 2020 only. We cannot provide future rent at this point. To apply, visit teamkyhherf.ky.gov. Since opening the applications on September 8th, we've approved $12.3 million in eviction payment reliefs that have helped 3,254 Kentucky households. All right, Team Kentucky Food and Beverage Relief Fund update. We've seen a great response to this fund. Nearly 4,300 applications have been submitted, $37 million in aid has been requested, and $30.2 million in aid has now been distributed. As a reminder, this fund provides financial assistance to restaurants and bars that were required to close for in-person dining and service due to my executive order. The grants are to be used as reimbursement for business expenses incurred between March 6th and December 31st, 2020. Unfortunately, we got to deal with misinformation and disinformation out there. It is not a loan. This is a grant to help people with the expenses that they have borne. They are not going to be expected to pay it back. Reimbursable expenses include items like rent, employee salaries, health insurance costs, inventory, and PPE. We have a total of $40 million in federal CARES grant money to fund this endeavor. We haven't reached the $40 million yet. So any eligible restaurant or bar owner who'd like to apply, do so before 11:59 p.m. on December 18th. After that, we're going to have to close the fund for applications because we have to spend all of our CARES Act money right now before December 31st. To see if you're eligible or to apply, log on to teamkyfbrf.ky.gov. Okay, so we had Dr. Burks in today, and in a little bit, Dr. Stack is going to go through a part of the presentation that she gave today. But one of the things that she said loud and clear were the efforts that we have taken, whether in the summer or now, have saved lives here in Kentucky. It's one of the very first things she said to me. She said, you all are doing a really great job, especially when you look at comparative mortality in Kentucky and other places. And for as hard as we've worked, that was great to hear, because we know, and we've seen the studies, that we have saved tens of thousands of lives here in the Commonwealth. The other thing that she talked about is right now where the country is, and even where Kentucky is the most dangerous time that we have seen in our fight against this pandemic. It's that inaction now is so much deadlier than inaction at other times in this virus because of how widespread it is. And what we see is that governors that do not have the powers to address this virus and or are unwilling to use them suffer significantly more death in their state. More people die, even when adjusted by population. And I want to give you just a concept of how dangerous this virus is right now and what inaction means, even compared to the summer. So let's start with comparison with us and Florida. Florida suffered this summer in a horrible way. They got hit hard, and because of a lack of action leading up to that, we saw this summer what inaction meant. This is normalized by population, average deaths, 7-day average. Look at the difference there. The space between their line, which is orange, and ours, which is blue, show all the extra deaths that they experienced that we didn't, even if you adjusted us by population. And remember, they were reporting 10, 11,000 cases a day, sometimes hundreds of deaths per day. And this was deadly. It was awful. What they went through was so difficult. And it's why we took the steps to stop our escalation during this period. And look at the difference in those two graphs about taking aggressive, real action and not. It's not just the difference between life and death. It's the difference between a whole lot more deaths and a whole lot fewer Kentuckians that we lose. And listen, the summer was dangerous, what we saw in Texas and Arizona, but it pales in comparison to what we see now. So what we're going to do, and hold on just a second, is we're going to overlay South Dakota, which has refused to take any steps currently in fighting this virus. And when we overlay it, it's going to show where they are now compared to us. But I want you to look, when we show this, at what happens to the Florida versus Kentucky, because this is prominent when you look at this difference in death. But how does it compare, even something this significant, to how dangerous it is right now? Go ahead, Jim. Look at that. Not acting now is catastrophic. Not having the ability to act right now is catastrophic. The amount of death normalized by population currently happening in South Dakota makes what happened in the summer in Florida and Texas and Arizona look like a blip. The sacrifice that we took over the summer to protect our people could be entirely wiped out by not having authority and ability to fight this virus in January and February and March as we're getting this vaccine out. Look, this is an example, when you look at South Dakota, of a governor not taking steps at all, and what it means in terms of loss of life. And remember, that space and the green line all the way down to the blue line would be thousands of Kentucky deaths that right now, as long as we can stay the course, as long as we don't surrender at the end and near the end of this virus, those are people that we won't lose. But if we see types of legislation, some of which has been pre-filed, we could very easily be that green line. And those are your relatives, those are your friends, those are your neighbors that we would lose. We cannot let that happen. Let's stay the course. Let's continue to fight this virus. Let's continue to protect one another. Let's get everybody who wants to vaccinated, and let's beat this thing. All right. Today's report, while again higher than we ever want them to be, is lower than last week's Tuesday and lower, significantly lower than the Tuesday before when we had over 4,000 cases. Today, we're reporting 2,946 new cases of COVID-19. Our positivity rate, 8.53%. In the last 3 days, it's really been consistent. To give you a comparison, last Tuesday, we had 3,114 cases we reported. The Tuesday before, 4,151. So again, better than the last couple weeks. We have an uptick, though, in our hospitalization in our ICU, 1,788 Kentuckians in our hospitals for COVID-19, 438 in the ICU. 246 on ventilators. New cases by county: Jefferson, 418, Fayette, 162, Warren, 123, Davis County, 122 cases, Madison, 120, Pulaski, 84, McCreary, 73, Hardin, 68, Laurel, 66. Laurel's been hit pretty hard. Boone, 63, Whitley, 60, Kenton, 59, Oldham and Clinton, 51. The others can be found on kycovid19.ky.gov. Sadly, we're reporting 15 new deaths today, due at least in part to COVID-19. And remember that even though our cases are looking better, we believe in the very least we have plateaued. Deaths follow the cases from about 2 weeks ago. So that escalation that we had results in people that we lose. So today we're announcing the deaths of a 68-year-old man from Boyd County, a 62-year-old woman from Caldwell County, a 77-year-old man and an 80-year-old man, both from Davis County, an 88-year-old woman from Graves, a 77-year-old man from Hardin, a 61-year-old man, a 64-year-old man, a 78-year-old man, and an 83-year-old man, and a 92-year-old man, all from Jefferson County, a 90-year-old man from McCracken, and then 3 from Ohio County, all women, ages 87, 91, and 91. And these aren't just ages and genders and counties. They're real people that we're losing. They're even heroes. So on December 11th, Kentucky lost a hero in the passing of Chief Robert Lee Orkes of Shepherdsville after a battle with cancer and COVID-19. The chief was only 55 years old. The chief's family shared that he was destined to be a hero. After losing his own parents, William and Patricia, early in his life, Rob learned to cherish family, love deeply, and live life to its fullest. He was lucky enough to have found his lifelong love, Billy Joe, when he was a teenager. They shared a love like no other and were together for more than 37 years. He adored Billy Joe, his son Patrick, his daughter Trish, their spouses, and his granddaughters, Presley and Riley. Nothing in his life came before family. But if you know Rob, you knew his heart was big enough to love more than just one family. His passion for firefighting started in 1984 and never left him. He loved the brotherhood of the firefighters and felt driven to be a leader. He had the opportunity to work for several fire departments in various roles, but he cherished his time as the chief of the Zonetown Fire District. He respected his position, and he always had the goal to make his community a safer, more enjoyable place to live. In addition to his duties as chief, he prioritized helping citizens of Kentuckiana through Crusade for Children, where his firefighters learned to work together with the community for the good of others. The chief was also known as the local Santa on the yearly fire truck visits. He touched more lives than I think even he could have ever anticipated. His crew, his colleagues, and his firefighters respected him for who he was and loved him for who they strived to be. Rob was a leader in all aspects in life and always wore his heart on his sleeve. You can tell from that photo right there. He knew exactly how he felt about you. If you spent 1 minute with him, you left a little happier and a little more loved. His silly sense of humor is irreplaceable. There wasn't much he wouldn't do to make you smile. For his many friends and family, his loss is immeasurable. But if you were blessed enough to know Rob, you were honored to love a hero. To Rob's family, to those little granddaughters, we are so sorry for your loss. And in his honor, we're going to protect other people just like he did during his life. We're going to wear masks. We're going to do right by our neighbor. We're going to live up to the example that he set for all of us. In addition to Rob, we have some other loss to talk about today. 2 more veterans at Thompson Hood Veteran Center in Wilmore have died of COVID-related complications. Brings the total number of veterans that we have lost in that center to 33. There are no active cases of COVID-19 in veterans in any of the 4 veteran centers now in Hazard, Wilmore, Radcliffe, or Hanson. There are 0 new COVID positive cases in veterans in any of the centers. And Thompson Hood has now gone 30 days without a new COVID positive veteran. But remember, this is what community spread does. This is us as a community letting these individuals down. We got to face that. We kept the virus out until October. Nobody infected, protecting those that had fought for us, our country's veterans. And just since October, we've lost 33 of them. It's not acceptable. We've got to do better, and we owe them more. So long-term care facilities, of which they would be included, 200 new residents testing positive, 109 staff, 20 additional deaths attributable in the system, including 1 staff member. This is why we have prioritized this group and why our goal is to get every one of the residents and every one of the staff members vaccinated in the next couple months. All right, with that, we'll turn it over to Dr. Stack, who's going to go through a little of the federal data used by Dr. Birx today.
Thank you, Governor, and good afternoon, everyone. James, if you could put up my slide deck, please. I'm going to share slides that we took directly from Dr. Birx's presentation today. Dr. Birx spoke with the governor and I and shared this information, and she also spoke with other leaders from Kentucky and shared this. So the observations she made were that the current surge we're seeing across the country is rising much more quickly than it did in the earlier surges. It's much more broad across the country. I think I used the metaphor before. It's like you took your grass seed drop spreader and seeded the entire front lawn, and now all the little grass is coming up all over the country. Well, we seeded the entire country with COVID, and now it's blossoming all over the country at the same time. The surge is also much longer than the early ones, and in just a second, I'll show you that visually. She also identified for us things which we know already and agree with her about, that new cases result in new deaths, and that we're seeing much higher numbers of deaths across the country, particularly as the cooler weather drives people indoors, that any gathering indoors without masks is a risk of spreading disease. It doesn't make a difference if it's out at a place of business in public or whether it's in your own home. They are all risk of spreading disease, and they should be avoided. Asymptomatic transmission, meaning people who have no symptoms while they are infected but are actively spreading infection, is a major source of transmitting disease. And therefore, you cannot assume that just because you or others say they feel well, that they are not infected or spreading disease. And also that testing is important. And we've invested heavily in Kentucky to support testing and have supported local health departments, hospitals, community-based testing through local health departments, and a number of other avenues, including distributing hundreds upon hundreds of thousands now of those Abbott Binax Now cards to a variety of locations across the state. So we have very much strong alignment with the message that Dr. Birx shared today. If you could show me the next slide, please. I think it's Jim today. This is national data. It's similar to what I shared on our purple stair-stepper graph for Kentucky in the past. You see the first escalation in the spring with the gray line. You see the second escalation in the summer, and you see the third one happening now in the winter. You can obviously see that the line is much steeper. I'm going to show this differently in 2 more slides, and I'm going to draw some other conclusions. If we could have the next slide, please, Jim. She made the observation when she spoke today that the first surge was smaller in multiple dimensions. The second surge was bigger. It rose more quickly and lasted longer. And the third surge is escalating much more rapidly than the first 2, lasting a lot longer and resulting in much more harm. And I hope the next slide now, Jim will show this using the same graph. The first surge was relatively small in comparison in total numbers. It hit smaller number of areas, and it lasted more briefly, less than 4 weeks overall before it hit peak and then plateau. The second surge lasted for about 5 weeks nationwide before it reached its peak and started a decline, but it rose again relatively quickly. And if you look to the right, the current surge, the one we're in right now, the one that Kentucky is desperately trying to prevent from becoming an even bigger crisis, has risen much more quickly, is lasting much longer. And now 8 weeks into this surge, it still has not yet reached its national peak, which is alarming because that means it could be far, far worse than it already has been. James, if you could show the next slide. I alternate James and Jim because we've got James and Jim both working on this. I'm sorry. So Jim or James, I think it was James in this case, has made an animation for us out of the 4 other slide progressions that Dr. Burke showed. So this is the number of cases per 100,000 people, and this goes all the way back to March, I believe, and goes forward from there. So if you could please start the animation. So as this goes, it's going to show you how the number of cases has progressed over time, and it actually shows shaded our surrounding states and what their impact was. The federal government has added additional depths of horror by making even darker shades of red. We have spared you that here in Kentucky. The darker reds are serious crisis areas where cases are really off the chart. If we can go to the next slide, please. This is the number of people admitted to the hospital. And I've said this repeatedly, more cases equals more admissions. So if you could start this animation, please. There we go. It doesn't really take much explanation, and you can see the areas hardest hit. Again, adjusted per 100 inpatient beds. So we adjusted all of these by units to kind of adjust for the capacity in the regions. And that shows you where the hardest hit hospitalizations have been so far. If you can do the next slide, James. This is the number of deaths per 100,000. If you could start it playing. And it's not just about cases. It's not just about hospital admissions. All those metrics lead to real people losing their lives. And it leads to other people obviously having other types of impairment and distress because of the dysfunctionality that the pandemic and the disease brings about. And then James, I think, is there one more slide, James? If you move to the next bit, wonderful. And test positivity is a measure of testing adequacy. Are we testing enough people? But when the disease grows much more rapidly than testing can grow, you start to see we fall behind and the number of people testing positive increases. And you can see that that chart has also changed to a much more red shade. Tennessee had a data problem on a recent week or something. She explained that's why it's whited out there. So I'm going to leave a few concluding thoughts on this. The governor has shared over the last few days that we had for a period 9 days sequentially of decreasing test positivity. We have had, I think now, at least some semblance of a plateauing of our cases for new positive cases. We will have to see what happens this week because I think that Thanksgiving is in direct conflict. The behaviors at Thanksgiving are in direct conflict with the measures we took with the executive order to keep ourselves further away from each other. We took those right before Thanksgiving. And notwithstanding that, the fact that we have a decline in cases last week instead of an exponential increase, I don't have any doubt, folks. We have shown in Kentucky 3 times, all 3 of those rises that Dr. Burke showed nationwide, we have interrupted those climbs in Kentucky 3 times. I no longer know what to say to those who will not believe this. There is a direct cause and effect relationship when people get close to each other without a mask on and spread their secretions, and, essentially spray snot and spit at each other, you spread infection. And when we stay away from each other and we cover our faces, we don't do those things, the infection doesn't spread, hospitals don't get overrun, and people don't die. We have one of the worst overall health statuses, unfortunately, in the United States of America. And despite that, we have one of the best performances in the entire country for low numbers of death across the state. At this point, we've shown 3 times that when we intervene, we can have a positive impact, save lives, and minimize disease. And other states who have taken very different paths have shown just how bad it gets when your hospitals are overrun, there's nowhere to go, the doctors, the nurses, the others are exhausted and worn out and can't help all the people who need help. So here's my admonition to the state as we look into the next couple of days. It strikes me that this job has been so unrelenting that Christmas is now upon us, and it feels like it's Groundhog Day over and over, and they all blur together. You know what needs to be done. As hard as it is, you need to stay with only your own household all the way into the new year. You need to not have private gatherings and parties. You should support, if you are able, and please support local business, but do it through takeout and carry out. Please support the businesses, but don't support the disease. Don't support the coronavirus by getting together with people outside your household in public spaces in indoor settings where you're going to spread disease. It is not safe, and people will pay a price for that. Some with their lives, others with illness, and others who aren't even infected by COVID because the hospitals will get overrun like they have in other states. Right now, if you have high-risk conditions, if you're over 60 or 65, if you have major medical problems, it is not safe to go into indoor settings with other people not wearing masks. It simply is not safe. And I urge you, we've changed our travel guidance today, and I was late to the press conference due to a prior commitment, but the travel guidance online now says that we discourage leisure travel until further notice. Until we get past the holidays, folks, please, it's time to hunker down. And remember, you can only control your own choices and your own actions. If neighbors and others in the community choose not to adhere to this guidance, and there's plenty of guidance out there. We said this for months before we had to finally get to the additional executive order before Thanksgiving. If people follow the current guidance that we already have in place, and if you adhere to the mask mandate, that's all the weapons you need. That's all the tools you need to keep people healthy, to keep people safe, and to prevent us from having the calamity here in Kentucky that is unfolding in states around the nation. You can do it. I have faith in you. But if others choose not to do it, just steer a wide path from them, stay away, and please don't support and don't participate in those behaviors. Nevermore have your individual actions had a chance to have more impact for more people, both in your immediate circle of friends and family and people you love and care about, but your broader community. And the final message I'm going to leave is about the vaccine. It is wonderful news, absolutely wonderful news this week that we have our first doses of vaccine in the state, that our health systems are beginning to administer it. I have to ask you all, this is a time for us to think about us, not me. This is a time for us to understand that we have a modern medical miracle. We have vaccines 10 months from the time we had our first case in Kentucky. There is nothing like that in immunization history worldwide. That is absolutely astounding. In that context, we now need people to be patient. Please don't ring the hospital phones and the public health department phones off the hook with all sorts of questions immediately and begging to get the vaccine. We are going to roll it out as crisply and cleanly and rapidly as we possibly can in as fair and an equitable manner as possible. I talk to thousands of people every week, literally thousands of people, hospitals, health departments. I join the governor for calls with other leaders across the state. We are trying to message as clearly, as consistently, as rapidly as possible. There is only so fast that information can get out, and there's still much we don't know. But these vaccines are a game changer. The beginning of the end of the epidemic is upon us, but it is going to take us the next 6 or more months to methodically work through this. So I thank you very much for your patience. It's absolutely essential. And I again thank the governor for the privilege to serve. This has been a singular honor to have the opportunity to serve in this time. And I'm looking forward to getting past this and finally getting to a vacation next summer when we can hopefully declare mission accomplished and we can help all the Kentuckians who've been hurt by this get back on their feet and get back to the lives that they miss so much. Thank you very much. And Governor, back to you.
Thank you to Dr. Stack. You know, I knew we'd been dealing with this for a long time. We got a question several months ago about smoking, and Dr. Stack didn't start the answer with "don't smoke." Well, our new travel advisory is "don't travel." Now, right now, it's dangerous. Don't travel. It can be that simple. The vaccine is out there, and we're going to make it. Appreciate Dr. Stack's effort. He works incredibly long hours and sees or experiences a lot of the frustrations that I and local health departments, hospitals, and others understand. We couldn't do this without him. All right, we will open it up to questions. We will start with Karen Czar from WUKY.
Good afternoon, Governor. Thank you. We've had a lot of questions from private school leaders or school districts where they are not over capacity and we're already able to make adjustments, meaning cut off enrollment so that they could socially distance and follow all those guidelines. With the new guidance that you set yesterday, if they are in a red zone, but they are already at reduced capacity, do they need to make any changes or can they move forward?
What on the red zone, orange zone, yellow zone, those pieces are recommendations as opposed to some other mandates that will be in the executive order that come out. But I think that those schools are already looking at. So if they are already at significant reduced capacity, what I would say is if you're in the red zone, just look at your overall operations. See where there's a little more that you can do to protect students, knowing that there's the community transmission. Just be thoughtful and be extra wary, given that level, the CDC says is dangerous everywhere in a community. And that's one of the reasons that we didn't just change the numbers. If the CDC says this number is dangerous, then we're not going to adjust that, just because so many of our counties are in the red zone. So again, what those recommendations are for the orange and the red zone is asking people to be really thoughtful and to not stop, to say, this is our plan and we've already implemented our plan and we're going to stick with our plan, and not say, okay, where are some other things that we can do a little bit more? Look at even the CDC continues to provide new and additional insights on how to make facilities, including schools, safer. So that's all we'd ask, and we'd ask for leadership in it. And that's going to occur for private schools on the school level, and it's going to occur for public schools on the school and on the district level. Joe Sonka from the Courier-Journal.
Thanks, Governor. Do you plan on providing a public running total of how many people are being vaccinated each day in Kentucky, along with any demographic statistical information about those people?
We're working on it. We were looking at that just yesterday. We don't have it up and running yet. The vaccine got here a little bit faster, and then we'll have to see if we can get that reporting every day. But we're working on it. This goes into a federal database, but it's something that the Department for Public Health was already working to create a dashboard. Certainly, we want to have demographic data if we can by the time that it gets out of the initial populations that we're looking to help. I mean, the demographic data for long-term care, obviously, we would see by age, but we need to be able to test as we go whether or not we're reaching underserved populations. And to do that, we're going to need some of that data, and we're committed to it. So we've got to know of say our educators when we get there, our individuals getting data even proportionate to the population or portion of the population they may make up. We got to make sure that we message to and are able to allay concerns that may exist in various communities. So we're going to be working really hard on that, and we're going to work to be transparent on it. Again, I saw a draft of a dashboard yesterday, but it's going to be a work in progress. Tom Latek from Kentucky Today.
Good afternoon again, Governor. I know you had said in your earlier briefing after a meeting with Dr. Birx that she was meeting with legislative leaders. Have you gotten any word on what came out of that meeting?
Well, that meeting had a presentation from Dr. Birx with some of the pieces that you saw today. Legislative leaders saw each and every one of those slides, got an opportunity to ask questions as well. I think some of the questions were technical about should someone in this situation or that situation be looking at the vaccine, and they got an answer directly from Dr. Birx. But Dr. Birx had called us in the governor's office coming in and said, we have this amount of time. What would you like for us to do? And so we offered the opportunity to legislative leadership without me in the room to ask any question from one of the two foremost experts in the country that have been dealing with this virus. And if you look at the slide she showed, I think that what that foremost expert told them without me in the room is that the steps we've taken work, and where people are not taking action or don't have authority to take action, you've seen really dire consequences. Joe Ragusa from Spectrum.
Hi, Governor. So I want to ask about contact tracing, and I'm sure you've probably seen the data released by New York a few days ago regarding contact tracing and what it has revealed in terms of where cases are coming from. And a large percentage, almost 3/4 of it, was household and social gatherings. Other places that have been targeted and restrictions in Kentucky and other places were kind of relatively minuscule in terms of their overall data. I wanted to know if you had a reaction to that, if you've seen it, and I know we've talked about this before, but why is Kentucky not able to provide data like this?
Well, we just have our local health departments working in the same database for the first time in our history as of October, and we hope to have more data available. But let me be really clear. Dr. Birx, who lives and breathes this, has every bit of data available to the federal government from every single state. Agreed that we needed to take the steps we took, and even included in-person dining in her slides showing to legislative leaders. Let's get off this fiction that the steps and the places that we had to include in our most recent executive order aren't places where this spreads. We have 3 times had to ask for sacrifices in those areas, and it's worked all 3 times. So if the question is why we chose what we did, it's because it's worked. It worked here, and it continues to save lives. We also addressed the gatherings by limiting gatherings in people's homes to 2 households, 8 people or less. Got sued over it, won thus far. But we took that step as well. But when you are going to take a swing at a virus, you don't say, well, about 40% of it happens here, we'll just do that. We've done, over that 3-week period, as much as we can to impact the virus. It is similar to what we did in July, and we're seeing good results. Shelby Lofton from WKYT.
Thank you, Governor. Of the healthcare workers who were vaccinated yesterday, can you give us an update on their status, if they experienced any side effects or reactions to the vaccine?
To my knowledge, they are all good. I think there's some soreness in the arms, but they understand that. We know of no adverse impacts at all. I think that the only thing other than a sore arm is a full heart and a lot more hope moving forward. It was moving yesterday to first see some of the initial vaccines, but then also the videos, certainly in Lexington, of a doctor who's been on the front lines holding that thank you note. This has got a long way to go. but this appears to be a very safe vaccine that is incredibly effective. So it's really good news. Mike Valenti from WLEX.
Yeah, Governor, thank you. It appears we may be on the precipice of ending a months-long stalemate on COVID relief. Right now, congressional leadership is meeting with Secretary Mnuchin to try to hammer out a deal. But new reporting suggests that state and local aid probably won't be in that comprehensive package. Obviously, we've heard you for months now stress just how crucial that is. Your response to that, and have you had any conversations with Leader McConnell about that?
I haven't talked to Leader McConnell, certainly in the last couple of days. Americans need help. They need relief. Those are on unemployment need an extension. That's got to happen. And that looks like it's going to move forward. But we provided our entire congressional delegation with a breakdown, not of different things we need for our budget, but just what it'll cost us to do the testing and continue to fight this virus for the first 6 months of next year. And it's about $350 million. Right now, what Congress is telling us is you are on your own in battling this virus, except for vaccine distribution, beginning in January. And that is an abdication of responsibility. In the very least, they ought to give us money to do testing. At this point, that's all I'd be seeking, is just give us the basic dollars to cover what it takes to continue to contain this virus as we get the vaccine out. Now, there's an end in sight. Why would we stop funding the programs that are working to protect people and identify people that need help? Think about this. If we don't have testing to show people are positive, think about all the stories, and we know that people are doing okay who are positive. Then they fall off a cliff. Some we lose, some we're able to get to fast enough. Well, people don't even know they're positive. By the time they get ready to go to the hospital, it is going to be too late. So what they're calling state and local aid may mean a lot of things, but I would hate to think that we are conditioning dollars for testing for a virus on business liability protections. Again, that just puts people in harm's way, and they ought to be able to come to some form of compromise on those two as well. Corinne Boyer from WEKU.
Hello. For people who are uninsured or underinsured or who can't afford the vaccine, will there be state or federal funding that will help pay for it? And if someone can't afford it, will that prevent them from getting the vaccine?
So the vaccine is supposed to be free, but the devil is always in the details, and we will see as it's rolled out. At different times, some have talked about a small administrative fee. We're going to make sure here in Kentucky that we do whatever it takes to make sure those that are uninsured or underinsured, and if there is any charge, can't afford the vaccine, can still get it. No one should have a barrier to getting this vaccine if they want it based on cost. That's my commitment, and we will make it happen. Julia Hunter from the Hoptown Chronicle. Do we have Julia? All right, we'll come back. Melissa Patrick from Kentucky Health News.
Hi, Governor. You said earlier today that Dr. Burke suggested Kentucky needs to increase its testing of those between the ages of 18 and 30. What exactly was her advice on how to increase testing in this targeted group, and were those suggestions that you will consider?
Well, certainly consider the suggestions, and we've got a really good working relationship with Dr. Burks. She believes that tailoring a testing site or sites specifically to that age group and having more of the rapid tests, in some ways trying to create an experience around it could help. And so those are ideas that we're looking at and we need to flesh out and figure out. It's certainly a population that if we could get to do regular testing we could not only see and prevent asymptomatic spread, but we could also get some behavioral changes because we all want to pass the test. And this is the only test that we ever take where, well, there's several, but we want to be negative as opposed to positive. We want the minus instead of the plus. So we'll absolutely consider that and try to figure out how it works. It does suggest some of the college testing that they have done was ahead of its time, and that may be a good model. Alex Ebert from Bloomberg.
Good afternoon, Governor. There are many stories, including out of our publication, indicating that President-elect Joe Biden will nominate Pete Buttigieg to be his Department of Transportation secretary. How will that impact Kentucky's ability to get funding for roads, perhaps bridges between your state and Ohio's in the next administration here, compared to your ability to get funding with such a close connection to Elaine Chao? Thank you so much.
I believe that we will be treated fairly. We've had a good relationship with the current administration, even with me being of a different party than the president and most of the cabinet secretaries. We believe we'll have a good relationship moving forward. Pete Buttigieg, I've met a couple of times. I believe I will know a number of people that are likely to work with him in that cabinet. Javier Becerra is a friend of mine who is going to be nominated for HHS, and with Kentucky's challenges that we face and healthcare being so important to us as a Commonwealth, I think that's going to be a big advantage. So I believe that we're going to be able to work well with Pete Buttigieg. Now, remember, he's mayor from Indiana, and we got a bridge that we need to build there too. So a number of large projects that I hope this administration gets behind, because we could create a heck of a lot of jobs at a time we need them. Okay, we'll go now to Julia Hunter from the Hoptown Chronicle for our last question. Oh no, Julia, did we lose you?
Okay. You have specifically tailored the vaccine distribution plan to lessen the burden on hospitals and healthcare workers. And I was just wondering if you could talk about how quickly you anticipate seeing those results and the burden on the hospitals start to go down.
So we believe that we will see burden on the hospital as far as members of long-term care needing to go to the hospital within a month. Now, that might not change the numbers hospitalized in a way that reflects how many resources are going to be freed up. For every long-term care patient that we are able to get this vaccine and that is not hospitalized, that frees up significantly more time for the doctors and nurses in that hospital to see a number of other patients, because of oftentimes the condition of someone in long-term care and how hard this virus hits them requires significant, sometimes around-the-clock attention from hospital staff. So I believe within the hospital, in ways that are going to be a little bit harder to measure, but I believe that those professionals working at the hospital will be able to tell you about it. Our capacity after the first, I would say, month of vaccinations in long-term care is going to be better. Now, also the number of healthcare workers getting sick is something that ought to decrease as well. Remember, there are a lot of healthcare workers, so it will take some time to get through them, but that's another place that we ought to see a change in those numbers. Still a couple things we don't know about the vaccine. If you can spread it or not. We do know it keeps you from getting sick. So we're gonna have to be a little patient in seeing the numbers. And like they say nationally, we need to get at least 70% of the population vaccinated to truly make a major, to truly get to the end of this. But I'm seeing that as not only possible, but probable. So a lot of good news today. still in a tough place, still have far too many cases, still losing way too many Kentuckians. But we are going to win. We're going to defeat this virus. We're going to defeat it in 2021. And we are going to get back some of the old normal things that we like and that we love. And then we're going to have some new things that we've learned along the way that I know we're going to be able to put to good use. Renewed compassion, embracing telehealth and everything that it can provide, building new jobs here in Kentucky that can be remote, working for companies all over the world in a way that we've never seen before. So it's another good day. It's the second best I've felt since March the 6th, yesterday being the best. We really look forward to getting this vaccine out to everybody who wants it. Be patient, and that patience is going to be tested, and it's going to be difficult because everybody's going to want it as soon as they can. We're going to make sure that we get it to you. We're going to make sure that we get those who are at highest risk first. But as soon as we can get them into Kentucky, we're going to get them into people's arms, saving relatives and people every day. So now, every day, we don't just save lives by the choices we make. We save lives by those we're able to vaccinate. So we'll be back on Thursday with more updates. Kentucky, keep working hard. We're going to win. Let's make sure we protect each other along the way. Thank you.